Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to the podcast series on school nurse trends. I'm your host, Dr. Candace Pierce, and joining me to continue this discussion is Robin Cogan. Robin, thank you for continuing this discussion with me.
Well, thank you so much for having me and asking some really important questions. I'm thrilled because I really want people to understand the full scope of school nursing practice, and I think your questions really help illustrate those.
Good, because over the next 30 minutes for this episode, I'm hoping to cover some significant trends that have been shaping the school nurse field and the impact of COVID-19, maybe some current mental and behavioral health issues that we're seeing today, and really just try to understand how school nurses can better address the LGBTQ+ and gender non-conforming students. And I know that school nurses also play a role in school safety and emergency preparedness and how you promote health equity. So we have so much to cover and not a lot of time to cover it all. So you want to jump right in?
Sure. Let me just give you an overview in terms of like a bigger picture of school health and some of the chronic health conditions that we often see in school. In our country, more than 40% of school-age children and teens have at least one chronic health condition. And that would include things like asthma, obesity, other physical conditions, and that also includes behavior and learning problems. So 40% of our student population of more than 90 million is a lot of kids. So, and their healthcare needs of these children with chronic illnesses is complex, and it's continuous, and it includes daily management and also addressing potential emergencies. This is why it's so important for parents to communicate with their school nurse. I think we talked about this in the last episode. Make sure your school has a school nurse there every day, all day, and find out what their qualifications are, what their education and their background is.
Right. Is it a nurse? Is it a tech? What's their level of education? So what are some of those emerging trends that you see impacting school nursing here in the last 10 years?
From a chronic health condition perspective, we have seen a rise in asthma, certainly. We have seen a rise in diabetes, type 2 especially. We have also seen a rise in food allergies and anaphylaxis happening, that emergency reaction to a food allergy that can be life-threatening, happening in students who had no known food allergies. So that's really concerning. And all of these things have impacted how we practice. So, for example, when I first started in school nursing 24 years ago, there was no EpiPen. We would have to draw epinephrine up and keep it, in a dark place and a handy place to use.
Right.
Just talking about things like diabetes management, what's happening now is there's tremendous technology used to help students and staff and parents manage sugar highs and lows so that kids are much more even. And so the technology is ever changing, and we need lots and lots of training to keep up with these many, many different and often competing pharmaceutical groups that are coming up with new technologies to measure things like blood glucose without a finger stick. That's a huge change for us at school, to diabetic pumps where kids are, being able to manage their own care during the day. And of course, the school nurse is hopefully always involved in promoting independence and really promoting students being able to understand what their chronic health condition means and how they can stay on top of it. Even things like asthma really educating the entire family, looking at what's triggering your specific asthma, because asthma is often triggered by things that people don't necessarily realize. For example, I had a student whose parents smoked, and they just did not realize that even though they didn't smoke in the house, that smoke stayed on their clothes. And so their child would be triggered just by smelling the smoke on their clothes. So we have
Hmm.
so many opportunities to provide very important health education, promotion, and prevention to not just our students, but our students and their caregivers at home.
Absolutely. So every year since I got married, I have gone to be a camp nurse for a week at a
Yay!
camp in northern Georgia. And so now I have girls. And so I actually go that week and I'm the camp nurse. I try to leave them alone, but it's really cool because you get to be there with them and kind of watch from the behind the scenes. But I have noticed an increase in growth hormones, allergy shots, the amount of medications for mental health, to include, like depression and anxiety and even ADHD. The amount of medications that we are giving our children has grown tremendously to where it's kind of stressful now to from when I started in 2007 to 2024. It's kind of stressful that week that I'm there at camp trying to keep track of all of these kids and all of these medications, some taking multiple medications. So I definitely see that increase that you're talking about.
Well, you would make a great school nurse because let me tell you, compared to overnight camp nursing, school nursing is a part-time job because we can at least, when we need to, send our students home. You can't do that at
Yes.
camp. They live with you.
24/7, you are open. I have been woken up in the middle of the night with hands that were cut because they went through a glass window. Like, how did that even happen? Um,
I call
to
that
somebody
camp
falling
after
off a
hours.
50-foot.
That's camp
Yes, it's
after
after
hours.
hours.
Yes.
Yes.
That's adult. The
To
adults camp is actually run by children and they have camp after hours, and that's the kind of things they do.
Yes. So, but doing that for a week is when I come home, I am mentally exhausted. It takes me the whole weekend to recover. Just it's a lot to keep track of. So I can't imagine being in a school where you have that many kids that you have to ensure that they have all the medications that they need. And how do you manage that?
Just imagine the documentation alone, making sure you have every single, T crossed and I dotted
Yeah.
because we need specific documentation to be able to provide medication during the school day. We also have to stay on top of, you talked about ADD medication. They are considered, a controlled substance. So we have to keep them
Hmm.
under separate lock and key, double lock and key, and count them and do all the things that we would do, in acute care setting. And the other thing is that, we're also tasked with collecting all the well, I would say emergency medication in case of. So all the albuterol, all the EpiPens,
Hmm.
anything that a kid might need should something happen. And so it's a huge undertaking. And then you put on top of that, making sure that every child in your school has every single immunization that they are required to have to be at school is see the all of these things are very time consuming. We have to do a whole lot better job utilizing the technology that is afforded to many other practices. We finally in New Jersey, in my school district, are able to interface with our state immunization registry and to be able to get immunizations uploaded into our electronic health record. Now, that doesn't happen
Hmm.
everywhere. There are still many, many districts that are handwriting everything. There are still many, many districts that are still sending information to physicians or providers, counting on the parent to be the deliverer of the information. We should be using technology to the utmost within the parameters of HIPAA and FERPA. I understand that, but we could be saving time, money, lost work days, lost school days if we would really take the time to take advantage of the technology we have already.
Absolutely. The efficiency and the effectiveness, and really being able to open up time for you to do your job, just like at the bedside. Nurses don't have a lot of time to do the job that they went to school to do because they're doing all the paperwork and all the,
And the
all the
job has
extra stuff.
expanded and the needs have expanded exponentially.
Right.
And that was, we're still working in a model from more than 100 years ago, if you think about it.
So, we had COVID come through and really, really kind of wrecked us in our schools as far as, sending kids home, not being able to go in the schools. So now that we're back and, getting back to that more normal pace of life for our school children, how have you seen the effects of what COVID has done as far as your roles and responsibilities as a school nurse?
So initially, when COVID first reared its very ugly and dangerous head, there was a huge push for the appreciation of not only school nurses, but of teachers because of our rapid pivot to having to go virtual. Unfortunately, that really high
Hmm.
level of appreciation soon turned to blaming school nurses for having to implement the ever-changing CDC guidelines that we were trying to follow. And I think what the general
Hmm.
public didn't understand about public health is that we were living through a pandemic in real time, that the science that was being used to change those guidelines was in real time. They usually have much more time to craft these mitigation
Hmm.
responses, but we were learning as the science was being understood and analyzed, and then they were coming up with quick turnarounds. We're one day we're quarantining for 14 days, the other day when we moved it back to 5, where there was so much confusion because of masking. My God, they're still litigating wearing a mask or not wearing a mask, 4 years later.
Hmm.
So the the problem happened because COVID was not addressed primarily as a public health emergency. It became a political hot button. And
Hmm.
then there were competing interests because it was also during the time of a very, very consequential presidential election that our most trusted, previously trusted, and independent public health institutions were being questioned and degraded, and it was really it created a cascade of misunderstanding and then purposeful spreading, not by them but of other people with their own interests, of misinformation across the country. And so the school nurse's role, while we follow CDC guidelines, it didn't mean that school districts were willing to follow CDC guidelines. And so it was a real I'm trying to think of the phrase, moral injury, truthfully, to school nurses to be put in the place, to be put in the space of being the messenger to families of things they did not necessarily want to hear. And we were in between telling families that they needed to pick their child up for this, and this exposure, or this, and this symptom, and then telling teachers no, they can stay because they weren't within 6 feet of so and so, and they weren't on the bus, and they weren't in the lunchroom, and the contact tracing that we had to do. I mean, the hours and
Hmm.
hours of effort that were put into trying to keep our school community safe was, truthfully, not only was it not appreciated, but it was attacked. It was questioned. Our integrity was questioned. Our knowledge base was questioned. I mean, I'm kind of making broad statements, but I've spoken to enough school nurses. I have run a support group for school nurses for the last 5 years through COVID about the things that we've all experienced. And so there were some school nurses who were incredibly supported. There were other school nurses who were very disrespected. And all
Hmm.
in all, it impacted all of our mental health and well-being.
I think when we look at COVID, as far as nurses in general, I think we all have a moral injury that we carry from our time spent at the bedside, in the schools, in the clinics. I think that unfortunately our population as a whole, we do carry that and have a lot of mental and emotional scars from what was experienced for exactly what you're saying, being stuck in that role in the middle and being told what to do this way and being told what to do that way and trying, and all we want to do is try our is do our best to provide high quality care to all of our patients regardless of their age, regardless of who they are.
Based
So
in evidence
abs
though, right? Based in evidence, and so when we're being asked to do
right,
things that are not evidence-based, that's where the
right.
moral injury comes, and so what we've done in the last few years now, COVID's on a bit of an upsurge now. Granted, we have medication, we have we have vaccine, we have ways to handle it, but, um, we're not now COVID is being classified in schools anyway as any communicable disease in terms of staying home for 24 hours, do not come back until you're fever free with
Mhm,
no medication, that kind of thing. But we know COVID has spread like wildfire this summer, hasn't it? Lots and lots of
mhm,
people who never got COVID before happened to get it this summer. But the other piece of that is so to repair the ruptured relationships, and there were many ruptured relationships, we have to acknowledge what is, what happened, and come up with ways to create opportunities to improve our connections, to not gaslight people, to say, yes, that was wrong. We could
mhm,
have, we need to learn next time because we know there's going to be a next time. Let's plan with you ahead of time so that we're not caught so off guard. Most of us were told, you're going to be home for 2 weeks and then we're all coming back. We didn't come
mhm.
back for a year.
Yep,
So
right,
there's a lot to that. A lot happened during that year. And then even when we came back, it was very stop and start. We came back part-time. Only some grades came back. I mean, it was complete chaos. It definitely calmed down. We know that thanks to science, things quickly turned
right.
around, but the damage has been done, and we're still seeing the after effects in our kids and in our adults. I'm more hopeful now than I was even 2 years ago, but it's there. I'm never going to forget it. And it definitely drives my advocacy and the need to speak out when you see things that are not appropriate or are going to go a way that is not safe.
Absolutely. So I want to move in because, we also know that COVID has, as we've said, a lot of mental and emotional aspects to that for nurses, for students, for parents. But I want to move into, and I have two questions. I want to kind of combine them together because I think they flow really well together. And the first one is, what are some of those current mental and behavioral health issues that school nurses are assisting with? And then also, how can school nurses better address the needs of the LGBTQ and gender nonconforming students? Because I know a lot of those also fall into some of those mental health issues.
Well, if you want to talk about moral injury, I feel for the students, the families, and the school nurses who are working in states that do not respect gender fluidity, who do not respect a student's right to choose, who do not respect um, some of the social changes that have been a part of our country, especially in the last 5 to 10 years. There's many competing interests that are trying to turn back the clock. I can tell you the story of a phenomenal school nurse I know. This was before COVID, but she was one of the first school nurses that she shared a story with me that I thought was so brilliant. Um, she was a high school nurse, and her high school insisted on graduation that students must choose the color of their graduation gown. They must be white if they're a boy and red if they are a girl. And her point was, why are we dividing our kids? Why don't we make everybody wear white or everybody wear red? Why do we have to put up these barriers and other people out? And she went on a campaign. Now, she did it as she was getting closer to her retirement, so I give her so much credit. But she was at the point where, what are they going to do to me? I'm going to retire soon. This is the hill that I will die on. I refuse to be part of making kids choose a gender that at this moment, maybe they're not comfortable with. Maybe they're questioning. They have the right to do that. Why aren't we supporting them exploring? Why are we judging this important kind of phase that they're going through? Let them figure it out with support. But why are we adding to the stress, duress? And we know the mental health impact when kids are not supported in this very fragile time. So she won, they all won, and those kids now only graduate in the same color gown. And
Well,
just
I'm
that
just trying to
one
figure out why. Why do we need two separate colors? I've never been in a school where
history,
we had two
tradition.
color gowns
Yeah.
to choose from.
Why? We can ask that question about a lot of these decisions that are made. Why
Yes,
do we do that?
absolutely. Like why? What's the point?
So it was a huge learning. It was such a simple answer to an issue that is taking up way too much time and oxygen out of the room. And it's none of our
Right,
business, actually. It's none of our business.
right.
But what we can do is create healing centered environments where kids don't feel judged and maybe feel more connected. But I also have to say that, nursing is political. We have a license to touch people. That in and itself, it's even almost radical at this point, right? To be able to touch somebody else. And so I give that nurse so much credit for taking that issue on. And my hats off to her and any other school nurse who will stand up for the mental health of their students, who will speak out and say things that people, want to put their hands up to their ears about. I speak out often on gun violence prevention. I have found a way to talk about it that is respectful to people who own guns and people who don't own guns. Just like my friend found a way to come to a mutually, like a safe space, a space where everyone can agree that we don't have to stress out kids by making them choose a color. Let's just all have the same color. I work in a space of, can we agree that keeping our kids safe is a shared value? So working on safe storage, promoting having gun locks at school, promoting education around safe storage. And we know that guns are here. They are not going away. There's almost 100 million more guns than people in our country now. Since COVID, almost 80 million guns were purchased just in those few years. So the question is, they're here. How do we live safely among them? How do we do that? We can do that. But first, we have to recognize our own rights and be respectful from where people come. But if you're choosing to have a gun, that's your choice. You have the right. What will you do to be a responsible gun owner and keep kids safe from having access to it? Because we know our kids know where everything is.
Yes, they do. And they're pretty savvy with electronics. So
Very.
they'll sneak right under your nose and you won't know. So what types of school safety and emergency preparedness really fall underneath the role of a school nurse?
Well, don't I wish they all did? And I have to tell you, I don't think you'll be too shocked to know that when it comes to safety, school nurses are not the first person that's on the school safety team.
No.
And that is really unfortunate. 52% of safety committees even have a school nurse on their team. And we are a critical role in school connectiveness, which is the key factor when you think about safe and supportive schools. And since we're the first responder for any school emergency, including a school shooting, how can we not be an active member of that safety committee?
Right.
And
Doing
these statistics come from a survey done by the National Association of School Nurses. Now, sometimes the committees that school nurses should be on but aren't on are because there is no school nurse in the building, or they're covering 3 or 4 buildings. But that shows
Mhm.
you, we are more than just tasks. We are added value to designing safe and supportive schools. So, can you create a framework for what a school health services suite of professionals should look like so that we can participate and attend in these important meetings?
Absolutely. And I do think that we are a missing team member in a lot of areas, even in hospitals, boards, school board meetings. We have a lot of expertise and critical thinking abilities that can be brought in. And I will say to our listeners, we have a few podcasts that are all about how nurses can use their voice in community policy advocacy. So we do have two podcasts that we released for 2024 specific to that. So I think it's really important that we get out there and use our voice for the expertise that we have to offer in a lot of areas that we don't even realize.
Right. Especially in school nursing, when we're not at the table, who's listening, right?
Mhm.
Because school nurses bring the voice of health to an education setting. That's our role. And often we're the only health professional in the school, if we're even in the school full time. Not to mention that can be not just lonely, but challenging to navigate a school community when we are the only health professional in the building. And that the connection that we have between health and learning is not always well understood by non-nurses at school. So,
Right.
there was a recent study that showed less than 50% of the nurses that responded felt that they were understood and respected by their colleagues a majority of the time. And only 1 out of 4 school nurses reported satisfaction with parental support. Even when it comes to the wellness team at a school, even on the wellness team, school nurses are underrepresented and underutilized.
Absolutely. I think that is a general theme for most areas where nurses work: understaffed, underutilized, not respected to the extent of their education and the abilities and opportunities that they could bring to the areas where they work. So, this is definitely a theme for our profession in general. But I want to go to how school nurses can help with promoting health equity and address the social determinants of health that's really becoming some hot topics these days.
Right. So it is a huge issue. I mean, first of all, I am a white nurse in a predominantly brown and black urban school district. And so I know every day I have to walk in cultural humility to be able to effectively work with my families. And so that takes a long time to really develop relationships, to create trust, to to be the person that people want to come to help them solve these very important issues. But school nurses can also really advocate for, let's say, this is a great example. Um, During COVID, all of our students, no matter what their background was, their socioeconomic status, they all received, once we came back to school, they all received free breakfast and lunch. That is something that all students would benefit from, right? And that's actually happening in some states across the country. In fact, I believe Minnesota is one of those states where all students have access to free breakfast and lunch. And it's these things that school nurses can call out, can look for resources, can be part of the solution by bringing programs and services to school. There's so many school nurses that have food pantries, clothes pantries. In my district, we have spent so much time and effort creating really important, solid relationships with community health organizations who bring immunizations on site so families don't have to miss time from work or school to get those important immunizations. We have groups that come on site to do those all important school physicals and sports physicals. Anything we see that we understand is becoming a barrier for students, number one, to be able to stay in school, to attend school, to be healthy and well, we can try to bring in those services. So whether it's a food bank, dental clinics, there's just a myriad of resources out there, but it takes time and effort and grant writing sometimes to be able to bring
Awesome.
these resources to your school district. But there are school nurses all across this country that are doing that every single day for their students.
That's amazing. It's amazing to hear about. So we're coming down to the end of our time, and I want to ask you this question. What advice would you give nurses considering transitioning into a school nursing role?
Well, I think what's really important, honestly, is that they spend time as a sub in a district to see if they really want to make that transition. I think once you sub, you really see what it's like. I would also say be an overnight camp nurse, because if you can handle overnight camp nursing, you can handle school
Oh,
nursing hands down, no problem. But put yourself in circumstances where you can either follow the school nurse and see what it's like, take a class to see if your state requires certification, just take one class, dip your toe in and see what it's like. But get that hands-on experience. All schools need subs. And so if you can find yourself able to sub, even if it's once a week, twice a month, it will make a big difference in making your decision about whether or not you want to make that transition. And I believe you really need to know, obviously, what the expectations, is there certification, what is the support like, what is the training like, what is the on-site job training, are they just dumping you at the beginning of the school year and telling you to figure it out like by yourself, which is pretty much what happened to me 24 years ago, or will you have a mentor? And also, what's the strength of your state school nurse association? Every state has a state school nurse affiliate, and most of those affiliates are all connected to our National Association of School Nurses. So there's a lot of support out there for us educationally, in advocacy, tremendous support through our state and national associations. And find out if your state has a state school nurse consultant as well. Ask those hard questions. Talk to your own kid's school nurse. Do they love it? Are they leaving? Are they saying, oh, you'll be perfect here, and they're like running out the door and trying to get you to take over their school? Like, what's the deal?
so that's going to wrap up our time for this episode and our series on school nurse trends. And just listening to you talk, Robin, one of the words that really stuck out to me the entire conversation was advocacy, using your voice. And this is a big role where you have to advocate, and you have your patient is basically the community, those students that are in the community, and the parents and the family units of each of the students that are in that particular school or even the district that you're in. So advocacy just really stood out as a huge role. So for nurses that are really interested in using their voice to advocate and to work towards, meeting problems within that particular community, I think this would be a really great role for them. What do you think?
Oh, it would be a wonderful role for them. And I want nurses to understand, just like parents, the power of their voice. We bring such a unique perspective, and I want parents to understand that we're on the same team as them. We want what they want for their kids. We want their kids to be safe, healthy, and ready to learn. Our role is to keep kids in school, not to send them home. And we want to work hand in hand with our families to make sure that that happens and to lower those barriers as much as we can to create that safe, healing centered school environment where kids can flourish.
All right, so that wraps up our time for this episode and our School Nurse Trends podcast series. Robin, thank you. Thank you so much for being here to be a part of this discussion, to advocate for this small niche of nursing and share your invaluable experiences that you're able to bring. So thank you for being here with me today.
Well, thank you. Thanks for inviting me and for this opportunity. I'm looking forward to listening to it.
Yes, absolutely. To our listeners, thank you for taking time to listen to our discussion. We hope that you have gained some really valuable insights into the emerging trends and issues and what it means to really be a school nurse and the impact that school nurses get to have. There are some organizations that you can look at that have some valuable resources, such as the National Association of School Nurses and even the American Academy of Pediatrics, that can offer a wealth of information, training, and support to help school nurses stay up to date on best practices and emerging trends that they should know about. So if you have not already, I also encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.